Welcome back to The Time of Your Life. I'm your host, Ethel Rasmussen. I'd like to welcome Donna Bilz, Program Manager at the Department of Aging, to the show. Welcome.
Thank you for having me.
Before we begin our conversation about evidence-based programming, let's start by giving some background information about Title III-D programs as discussed by the Older Americans Act.
The Title III-D programming is funding that we receive through the federal government. It's through the Older Americans Act, and it's specific for evidence-based programs. So that means that the programs have to meet certain criteria.
Donna, can you explain to our viewers the concept of evidence-based program and how they work?
Evidence-based programs have been proven to work through extensive research, data collection. They have the backing of a federal agency. They've been tested that the outcome and the results have been proven to work.
BCDA offers several of these programs annually. Let's start by discussing each program and when they're offered. Okay. For instance, Chronic Disease Self-Management Programs, also known as CDSME, is one of the tried and true programs that we've done at BCDA. Can you talk about the program and the population it targets?
The Chronic Disease Self-Management Education Program is through Stanford University, and it targets those 18 and older that need to self-manage, be self-advocates for their own chronic condition. At the agency, we've offered it since about 2006.
Excellent. Let's move on to Diabetes Self-Management Education, also known as DSME. Please share some information about this program and why it's so successful.
The Diabetes Self-Management Program is very successful in helping folks manage their chronic conditions, diabetes, with helping them understand nutrition, planning meals, exercise, communicating with their healthcare providers, their families. People have a better control of their diabetes by being their own self-advocate, and a lot of the seniors come back and tell us that they've lowered their A1C number, or they're off not all the meds anymore. They can control it by diet and exercise.
One of the principles of those two programs is the toolbox effect, that you're teaching them the tools that they'll put in their toolbox to better manage themselves.
Correct.
Would you agree with that? Definitely. Stepping on Enhanced Fitness and Tai Chi for Better Balance takes evidence-based programming in a direction of promoting physical activity. Can you talk about each of these programs and the benefits they provide?
The Stepping On program is a fall preventions education program. It's a 7-week class, 2 hours each week. We also bring in guest experts, like vision experts, pharmacists to talk about medication and falls. We teach 8 core exercises to help with balancing strength, to maintain their independence. We also talk about pedestrian safety. Then we talk Tai Chi for Better Balance is a class that is twice a week for an hour. Again, core exercises to maintain strength and balance, again for fall prevention. And then the last one was Enhanced Fitness. They all have to do with fall prevention. That one has strength and flexibility exercises. It has low impact aerobics. That one meets 3 times a week for an hour each week.
And that's so important because fall prevention is one of the key things older adults need to pay attention to. So let's move in a different direction and talk about a new program called Time Slips, which benefits those with dementia or possible memory issues.
That is trying to encourage a creative outlet for those just starting to experience what you said. And it's been real successful with our Center Connection folks in our senior centers, but we're finding that all the seniors are enjoying it. It's creative storytelling. And then after they work on these stories, they are put on the web and they are published. So it's very interesting to see the creative outlet. It's not just focusing on just the dementia or anything like that. It's just encouraging their creative side.
That sounds very interesting. Let's say some of our viewers are interested in joining some of these evidence-based programs. How can they register or find out more information?
Well, they can call 410-887 2040, 2040, and they can also call each individual center. All the newsletters with this information is posted. It's also on our health education website.
Excellent. So lots of ways to find it. Thank you, Donna, for sharing this valuable information.
Thank you for having me.
We're going to take a short break. When we return, Senior Center members will share their experience with these evidence-based programs.